Welcome to Dead Souls Social Club.
Now I am become death, the destroyer of worlds.
If you enjoy our show and you find our research interesting, please leave us a 5-star review on your chosen podcast platform. Something that small really does go a long way in helping us out. You can find more about us and the research that we do by heading over to Instagram and searching our name. As always, thank you so much for joining us tonight. Just a short episode tonight, folks. We have a multi-part series coming up next, but I wanted to drop this episode in first. I hope you all find tonight's show informative.
A mystery disease known as the gay plague has become an epidemic unprecedented in the history of American medicine. That today from the Center for Disease Control in Atlanta. Topping the list of likely victims are male homosexuals who have many partners and drug users who inject themselves with needles. Medical experts say the disease kills 4 out of every 10 people it strikes and that it threatens to explode in the nation's cities.
AIDS. HIV. Even though a positive test can still be considered a life-altering event, with the advancement of modern medicine, it can be treated with medication and a healthy lifestyle. Currently in the Western world, a diagnosis of HIV can still allow you to live and have a full and long life. But this was not always the case. Just 30 years ago, a HIV diagnosis would have meant a death sentence. This was within my own lifetime. The stigma attached to the virus and how people who acquire it were viewed in society became widespread throughout the virus emergence on the world stage throughout the 1980s. AIDS stigma became commonly expressed in conjunction with one or more other stigmas, particularly those associated with homosexuality, promiscuity, prostitution, and intravenous drug use. I say this in the present tense, as although great strides in treatment of the disease have advanced greatly, the stigma associated with AIDS remains. Whilst a deep dive episode within itself, I'm not going to discuss the social impact and specifics of how the AIDS epidemic ravaged across the globe throughout the 1980s and 90s. Tonight I'm going to touch on its emergence. No one really knows how HIV or AIDS came to be, or where it came from. Well, not exactly. Even now, all we know is that AIDS emerged in Africa. HIV, the virus that causes AIDS, had jumped from chimpanzees to humans sometime early in the 20th century, likely between 1890 and 1920. To date, the earliest known case of HIV-1 infection in human blood is from a sample taken in 1959 from a man who had died in Kinshasa in the Democratic Republic of Congo, or what was at that time called the Belgian Congo. Further, there is no true known source of who was considered to be patient zero. Though for many years a flight attendant from Quebec City in Canada named Gaishan Duga was incorrectly and unfairly labelled as the person who brought HIV to the North American continent. To be clear, he was not, and his name was horrifically dragged through the mud for many years in an awful example of a media witch hunt. Gaishan Duga was heavily featured in Randy Schilt's 1987 book titled "And the Band Played On: Politics, People, and the AIDS Epidemic." Released in 1987, the book attempts to document the outbreak of the AIDS epidemic in the United States. In the book, Schiltz refers to Duga as Patient Zero and vigorously portrays him as having an uncontrollable urge to allegedly intentionally infect or at least recklessly endangering others with the AIDS virus for which Duga was infected. Schiltz described Duga in the book as being a charming and handsome sexual athlete who, according to his own estimation, averaged hundreds of sexual partners per year. Duga claimed to have had over 2,500 sexual partners across North America since becoming sexually active in 1972 at the age of 19. David Francis' book, titled How to Survive a Plague, published in 2016, quotes Schiltz's editor, who expressed his regret for having, quote, made a conscious decision to vilify Dugar in the book and publicity campaign in order to spur sales. Geshen Dugar died in March of 1984 from kidney failure caused by his HIV infection. It would be more than 30 years before the public knew that Dugar was not in fact patient zero in the AIDS epidemic. The first news story regarding the disease appeared on the 18th of May 1981 in the gay newspaper New York Native. AIDS was first clinically reported less than a month later on the 5th of June 1981 with the emergence of 5 cases in the United States. The first case in the United Kingdom was reported roughly 6 months later in December 1981. The first case of AIDS in the United Kingdom would be reported as from a 49-year-old gay man who regularly visited Florida in the United States. The man was named John Eady. He was the owner of a guest house in Harrogate, North Yorkshire, and was an active homosexual. Though he died in December 1981, it wasn't until November 2021 that the identity of this man was released to the public following an investigation by an ITV journalist. In the United States, the initial cases of the virus were a cluster of injecting drug users and gay men with no known cause of impaired immunity, who each showed symptoms of pneumococcus carlini pneumonia, or PCP for short. It was a very rare opportunistic infection that was known to occur in people with extremely compromised immune systems. Soon thereafter, an unexpected number of homosexual men began to rapidly develop a previously rare form of skin cancer called Kaposi sarcoma. In quick succession, many more cases of PCP and Kaposi sarcoma started to emerge, alerting the US Center for Disease Control and Prevention. Thus, a CDC task force was formed to monitor the outbreak. By the end of 1981, a global AIDS pandemic had been declared. To this day, it has not ended. In the early days, the CDC did not have an official name for the disease, often referring to it by way of diseases associated with it, such as lymphadenopathy, which was the disease after which the discoverers of HIV originally named the virus. They also used Kaposi sarcoma initially, and opportunistic infections, the name by which a task force had been set up in 1981. At one point, the CDC referred to it as the 4H disease. This was due to the syndrome seemingly affecting heroin users, homosexuals, hemophiliacs, and Haitians. I kid you not. The term GRID, which stood for Gay-Related Immune Deficiency, had also been coined around this period. However, after eventually determining that AIDS was not associated to the gay community alone, it was realized that the name GRID was misleading, and thus the term AIDS, short for Acquired Immune Deficiency Syndrome, was introduced at a CDC meeting in July 1982. I guess that realization wasn't made when they saw that people other than Haitians could get the virus though, because viruses rarely respect political borders and national identity. Anyway, by September 1982, the CDC had started referring to the disease as AIDS publicly. In the early part of 1968, a 15-year-old African-American boy from Missouri named Robert Rayford admitted himself to the city hospital in St. Louis. Some remember Rayford as going by Robbie, others say Bobby. He was enormously shy and mentally slow. There is evidence to show that he may have been intellectually disabled, though no diagnosis was made during his lifetime, which isn't surprising given his background and the time period. Robbie was complaining of shortness of breath, and during a physical examination, the doctor who was treating him also noted that his legs and genitals were covered with warts and sores. Additionally, he also had severe swelling in his testicles and pelvic region, and he was noted as being very thin and pale. Robbie told the doctor that he had been experiencing these symptoms for around 2 years, since 1966. Tests conducted on Robbie also confirmed that he was suffering from a very severe case of chlamydia, which had unusually spread throughout his entire body. Robbie had declined a rectal examination request by hospital personnel and was described as somewhat uncommunicative and withdrawn when he was questioned about his sexual history. He would contradict his statements at first, claiming he was the, quote, stud of all time and a gifted ladies' man, though he later claimed that he had only been with one sexual partner who was a teenage girl from his neighborhood and who he stated he suspected had given him the disease. Robbie came from Delmar Boulevard in Old North St. Louis, an extremely poor neighborhood, with his family consisting of him, his single mother, and a sibling. Doctors treating Robbie suspected him of being an underage sex worker and having been the recipient of receptive anal sex, though they never considered the possibility of him being the victim of child sexual abuse, as was the kind of thinking during that period. Later on, in 1968, Robbie's condition seemed to have improved moderately, but by March of 1969 his symptoms reappeared and worsened significantly. He had an increased difficulty breathing and his white blood cell count had plummeted, having developed a fever and pneumonia. Doctors conversed with one another and all stated that it had appeared his immune system had been somehow compromised, and it appeared as though it had completely shut down. None of the doctors had ever seen anything like this before. At 11:20 p.m. on the 15th of May 1969, Robert Rayford died of pneumonia. He was aged just 16. An autopsy of Robbie's body, which was led by Dr. William Drake, identified a number of abnormalities. Small purple lesions were discovered on Robbie's left eye, along with soft tissue. At the time, Dr. Drake concluded that the lesions were Kaposi's sarcoma, a rare type of cancer which mostly affected elderly men of Mediterranean or Ashkenazi Jewish ancestry, but was almost unheard of amongst black teenagers. A sample of Robbie's blood and tissue was kept in storage for later testing. In 1984, Dr. Marlis Whitty, one of the doctors who had cared for Robbie, tested tissue samples that were preserved from Robbie's initial autopsy. She tested them for the presence of HIV once the virus had started to emerge, but the test came back as negative. Although in June of 1987, Dr. Whitty again decided to test the tissue samples from Robbie's autopsy, this time using Western blot, a commonly used analytical technique in molecular biology that at the time was the most sensitive test available. The test found HIV detectable proteins in the blood sample and also HIV antigens in the tissue samples. In 1999, a report detailing the findings of Robbie's testing was made public, even though some in the scientific medical community would state that contamination of the test could have been possible. Unfortunately, doctors are no longer able to test any blood or tissue samples from Robert Rayford, as the last known samples were destroyed in a lab in 2005 during the Hurricane Katrina incident. Robbie Rayford never traveled outside the Midwestern United States, and he had never received a blood transfusion. If Robbie was indeed infected with HIV, as the evidence indicates, the mode of acquisition is assumed to have been through sexual contact. Having never left the country, those who claim that Robbie represented one of the first cases of HIV infection theorize that AIDS was likely present in North America way before Robbie began to show symptoms of the virus in 1966. Consider how Robbie never ventured to cosmopolitan cities such as New York, Los Angeles, or San Francisco, where the AIDS epidemic was first observed in the continental United States. Thus, the only notable international connection to St. Louis at that period in time was TWA's main airline hub. Doctors, biologists, and other scientific researchers who investigated the case in the 1980s speculated that Robbie Rayford may have been sexually abused or a victim of child prostitution, and summary came to contract the virus from an abuser. Let's also discuss a Norwegian sailor by the name of Arne Vidar Rode. Rode was the first confirmed HIV case in Europe, though the disease was not identified at the time of his death. Thanks to the work of scientific investigative journalist Edward Hooper, we know that Rode began his career in the Merchant Navy in 1961 when he was just 15 years of age. Hooper published his research in the year 2000 in a book titled The River, A Journey Back to the Source of HIV and AIDS. In the book, Hooper shared that Rode visited Africa twice during his time in the Merchant Navy. The first time was in 1962 while he served aboard the Hogue Aronde down the west coast of Africa and eventually docking in Douala, Cameroon. While in Douala, Rode contracted gonorrhea following sexual contact with several local females. Rode had retired from the Merchant Navy by 1968, choosing instead a career as a long-haul truck driver throughout Central Europe, particularly West Germany. During his time as a truck driver in 1968, Rode suffered from joint pain, lymphedema, and lung infections, but he couldn't explain why his health seemed to be deteriorating. This was the same year that American teenager Robert Rayford first sought medical help, citing similar symptoms. Rode's condition stabilized with treatment until around 1975, when, like Robert Rayford, his symptoms suddenly worsened. Rode developed motor control difficulties and dementia and died on the 24th of April 1976 at the age of just 29. His wife grew ill with similar symptoms and died 8 months later in December. Rode's 8-year-old daughter also died of HIV the following month on the 4th of January 1976. Arnie Vidar Rode and Robert Rayford are now cited as examples of early cases of HIV in Europe and the United States during the same period in the mid-1960s, almost 20 years before the virus swept the globe in a pandemic that has taken almost 40 years to get to a point of containment. And even with the advancements in medicine and other treatments for the virus, it's still a significant threat to life in the one place where it first emerged in humans. As I previously stated, the HIV virus is believed to have originated in non-human primates in West Central Africa and was transferred to humans in the early 20th century. HIV-1, there are 2 strains of the virus in humans, appears to have originated in southern Cameroon through the evolution of SIV, a simian immunodeficiency virus. This virus infects wild chimpanzees. The closest relative of HIV-2 is SIV-SMM, a virus derived from the sooty mongabe, which is considered an old world monkey living in coastal West Africa around southern Senegal to the western Ivory Coast. New World monkeys are resistant to HIV-1 infection. HIV-1 is thought to have jumped the species barrier on at least 3 separate occasions. Additionally, there is evidence that humans who participate in bushmeat activities, be it as hunters or vendors, commonly acquire SIV. Similar, you are likely thinking, to how humans acquired the COVID coronavirus in 2020 from bats or pangolins. SIV is a weak virus, however, and it is typically suppressed by the human immune system. It is thought that several transmissions of the virus from individual to individual in quick succession are necessary to allow it enough time to mutate into HIV. Furthermore, due to its relatively low person-to-person transmission rate, SIV can only spread throughout the population in the presence of 1 or more high-risk transmission channels, which are thought to have been absent in Africa before the 20th century. Those proposed high-risk transmission channels allow the virus to adapt to humans and spread throughout society. Genetic studies of the virus suggest that the most recent common ancestor of the HIV-1 group dates back to around 1910. Proponents of this dating link the HIV epidemic with the emergence of colonialism and growth of large colonial African cities, leading to societal changes including a higher degree of sexual promiscuity, the spread of prostitution, and the accompanying high frequency of genital ulcer diseases such as syphilis or gonorrhea in nascent colonial cities. The alternative scientific theory, however, states that HIV emerged from the aftermath of unsafe medical practices in Africa following World War II. Examples of this being unsterile reuse of single-use syringes during mass vaccinations and antibiotic and anti-malaria treatment campaigns, all being the initial vector that allowed the virus to adapt to humans and spread, it is thought. Whilst we may never know for sure what the trigger moment was in the emergence of AIDS, it is now just another pinpoint in human history that we can never undo. Conspiracy theorists will tell you that the CIA developed AIDS and released it into the general population. Religious extremists may explain that AIDS is a punishment from God for mankind's dalliances with immorality. Whilst these reasons for why we are living in a world with AIDS are both laughable, offensive, and ridiculous, what is almost always forgotten still is the real human stories and tragedy that stand behind all the noise. 2 decades ago, HIV was killing over 4,000 people every single day. Today, almost 30 million people are accessing life-saving treatment, and AIDS deaths have been cut by 69% since their peak in 2004. Since the beginning of the epidemic, 85.6 million people have been infected with the HIV virus, and around 40.4 million people have died from HIV. In July 2000, the United Nations announced that it was their belief, based on the information they have gathered, that half of all teenagers in Africa will die prematurely due to AIDS.
Federal health officials say as many as 1 million Americans may have been infected with the AIDS virus, and more than 12,000 are expected to develop the deadly disease next year. Now, that would double the number of cases since 1981 nationwide.
Thank you for taking the time to listen to our show tonight. Be sure to leave us a 5-star review on your chosen podcast platform and subscribe to our show so that you never miss an episode. Our shows aren't sponsored by any company or corporation, so any support you can give us goes a long way in supporting the work that we do. From all of us here at Dead Souls, sleep tight.